Good evening, everyone, and welcome to our second CamAPS FX webinar. Before we begin, I'd just like to remind everyone, please, can you have your cameras off and mute yourselves throughout the presentation, just to make it easy for the presenters to present. And please ask your questions via the chat function. We will have a section at the end to allow those questions to be asked and for our presenters to answer them. So we'll just give it a few more minutes as we've got a few more people still joining us, and I can see their audio linking. So just to reiterate, please feel free to ask your questions via the chat function, but please keep your videos off and your sound on mute, please. Thank you very much. Just the last few joining, and then we'll get going. Great. Okay, so let's begin. This is our second in the series. We've got another 3 webinars planned, as you can see on the screen. They run the first and third Wednesday of every month, and they're designed as informal webinar sessions. So we prepare about a 20-minute presentation to go through the topic and then allow plenty of time for questions. In the new year, we'll be doing further, probably around exercise and a few other topics that keep coming up. So please do keep a lookout on social media, as well as our websites for the advertising of them, and do feel free to book in. Right, so this is the team who are presenting the webinars. Charlotte and Sarah will be doing our presentation today. Roman Havorka won't be with us today, but he is the brains behind the CamAPS FX system, and we will hear from him in other webinars. And I'm Candice Ward. I'm just facilitating the day and sort of answering your questions and just keeping things to time. Right, so I'm going to hand over to the team. Thank you.
Thanks, Candice. So this session is aimed to be really practical around getting ready to use the CamAPS FX closed loop system and everything that you need to do to get set up and ready to go. So what we're hoping to go through is a bit about the initial training, how you go about registering for the app, and the difference. There's a slight difference between access in terms of self-funders and people who have funding via the NHS. We'll go through how you download the app onto the smartphone. We'll talk about a few things you need to do with the pump to prepare it, and then we'll go through how you link the component parts of the system, and then just a short bit about setting up some particular settings initially on the app. So to start off with, just thinking about the component training. So someone using the app, we would expect them to be competent in the use of the Donna insulin pump and the Dexcom G6 sensors. And in terms of training, Donna pump training can be sought via people's own diabetes centres. Advanced Therapeutics, who are the distributors of the pump, are very happy to be involved with training and support of centres. And there's online Donna refresher training on the CamAPS FX portal on the CamDiab website as well. There's a Donna refresher module on there. In terms of Dexcom, again, people can seek Dexcom training via their diabetes centre, or Dexcom reps are really happy to support centres in training patients directly as well. In terms of training for the CamAPS FX, there is some modules, the training modules available via the website. So you've got the website link down there. So the website takes you through to the CDEC website, and there's essential HCP and user training that generates a certificate which you'll need in the future to unlock the app when you pair. We'll go through that in a little bit later. There's also lots of other training topics available there that are relevant. So carb counting refreshers, like we said, there's a Donna pump refresher. There's a module on optimization, there's a module for schools training, and there's going to be more topics coming that will be relevant as we go on. So first of all, registering for the app. So if you have someone who has NHS funding, just a kind of a note about that. First of all, we're working very hard to try and increase access generally for all closed loop systems, including the CamAPS FX. So we know that in certain areas, people have been given funding in different ways in different areas. We can help you with that if you need either business template, and we can provide health economic data as well. So anything like that that you feel you need that might be helpful, get in touch with us via the support email address on the CamDiab website. Assuming you've got approval for NHS funding for one of your for a patient, what would need to happen at that centre is they would either need to set CamDiab Limited up as a supplier to the trust via your usual procurement process, or else it's possible to order the app alongside the pump via Advanced Therapeutics now. If you're doing it via your trust, CamDiab would await a purchase order from your trust for the system, and what we would need is the pump serial number to be emailed to the CamDiab support email address, just giving the pump serial number so it can be added to the system so that it can be accessed when you come to link the devices. And that pump serial number, you can either find it in the shipping information, or actually it's written on the end of the Dana pump. It comes on the boxes that they come in. Or what we normally do is when a pump is ordered, just ask Advanced Therapeutics when they ship it to just also ping you an email with the serial number of the pump that they've shipped, so that you can get ahead of the game and have it uploaded to the system. For people who are self-funding, it's slightly different. It's all via the website. So you would go to the CamDiab website and you would click on orders, as you can see on the top there, and you would go into orders and you would choose the package that you wanted to subscribe to, and then once you choose that, it takes you through a registration and ordering process, during which you will still enter that Dana pump serial number. And downloading the CamAPS FX app to your Android phone, first of all, really importantly, you need to make sure that your Android phone is one that can be found on the Dexcom G6 compatibility list, and there's a link to that there. Once you're happy that your phone is one that it's compatible with, you would search for the Amazon App Store on your phone's browser, and then you would search for the CamAPS. You would download the Amazon App Store, and then you would search for the CamAPS FX, or you can scan the QR code to find the app itself and install the app and log in. And during that installation and login process, there's you would register, and part of that it involves a PIN code being emailed to the email address that you registered with, which you will then need to put in as your verification code into the app to link it to register, complete the registration process. On the CamDiab website, there's a full installation guide under the support section, so you can click on support, go down to technical and educational support, and there is a literally screenshot by screenshot guide to how you install the Amazon App Store and then the app from the Amazon App Store.
Great. So moving on to thinking about getting the pump ready, so either the Donna RS or the Eye insulin pump, and just making sure it's sort of good to go to start with the app. So one of the most important things is that the extended bolus needs to be switched on, and often in the default when you first start with the pump it's switched off. And the reason this is really important is because when closed loop is up and running and you're in auto mode, the way that it does it is it pushes the pump basal rates down to 0 and then calculates new extended boluses every 10 to 12 minutes depending on what the glucose is. So if the extended bolus is not enabled on the pump, you won't be able to start in auto mode, and what you'll find when you start it in auto mode, it won't go in, and it will tell you, you'll get a message on the app saying you need to turn extended bolus on. So it will direct you to it, but that's really key in order to get up and running in auto mode. And you can see in the diagram where you can find that on the pump. But as Sarah says, people need to be sort of familiar with the pump and the menus before they start with the app. In terms of other settings, we would expect the pump, the basal rates and the carb ratios to be set up and these to be accurate, just in case the auto mode is not available, and people need to be sure that those basal rate settings and things are reflective of what people need. In terms of when people are in auto mode, which settings are really used by the app, it's actually just the insulin to carbohydrate ratio. So the app just reads the settings from the pump, and the only one it reads is the insulin to carbohydrate ratio. Because it calculates its own basal rates via the extended basal rate, and it calculates its own estimation of insulin sensitivity and active insulin time, which it continuously modulates depending on the user, then those settings aren't utilized when you're in auto mode, but it's important that they're accurate for times when perhaps it's a sensor change and auto mode is not available because there's no sensor data, that those are set up correctly. The other thing that we like to prepare with the pump beforehand is in terms of the overall sort of safety settings, which can be found in the Dana pump in the doctor's mode, which is a sort of hidden menu of the pump. And actually there's not much information about it in the pump user manual, so it is worth just making sure that this is done sort of in advance. So to get into the doctor's mode, you need to press the 3 buttons, the plus, the minus and the across arrow, all at the same time, and then it will bring up this screen where it wants a password. Now, depending on whether the Dana pump is a sort of older pump, so before March this year when it was shipped, then it just wants the code 3022. If it's a newer pump, so manufactured and shipped after March of this year, then it wants 30 and then X and Y, where X and Y is the day of the shipping, and you can find that in the shipping menu information on the pump. So that's just to get you into this hidden doctor mode menu. Once you're in the doctor's mode, there's a series of sort of settings, and these are sort of what we generally set people up to go on. And the key ones here really, so decreasing ratio, as those of you who are familiar with the Dana pump, equates to active insulin time. So 25% is a 4-hour active insulin time, 30% for 3-hour, or 50% for 2 hours. And then the main thing really here is the bolus maximum, which we tend to set at half of the total daily dose. And this is often quite liberal, but that's because the closed loop is calculating a new extended bolus every 10 to 12 minutes. We want to make sure that that doesn't get maxed out if somebody's high for one reason or another. The other thing to think about is the daily maximum, and here we use 3 times the total daily dose. And again, this is possibly more liberal than you would normally use a standard pump therapy, but we've seen from studies in the past how variable people's day-to-day insulin requirements really are. So what it means is that if somebody's particularly insulin resistant one day or has a really high insulin requirements, the pump is still able to operate with auto mode ongoing, and people aren't sort of kicked out of auto mode because they've exceeded that total daily dose. So these are really the settings that we use pretty much when we set somebody up, but feel free to sort of adjust them as you would do yourself. But as I say, we tend to give more liberal ones so that people can remain in auto mode for as much time as possible. So moving on to, once the pump is already set up, what we want to do now is link the 3 devices, so the pump, the CGM and the app. So to set up your CamAPS FX account, once you've downloaded the app, which is what Sarah went through previously, what you need to do, and you can see on the menus here, is sign up right at the bottom, and then it'll ask you to complete your email address and a password. And then at that point, a verification code will be sent to your email address, which you then need to enter into the app. If there's any issues with this, it's usually because the phone isn't connected to Wi-Fi, so just make sure that that's the case. And then that's pretty straightforward. In terms of then linking the pump, it's quite intuitive when you're setting it up. It'll take you through menu by menu, and you just select the pump which you have, so either the R, the RS, or the Donna Eye. Which is coming very soon, and then press continue. It's important, if you've previously been using the Any Dana app or any other app, that the pump is unlinked from that app before you do this, because most of the time the pump can't be linked to two separate apps. So it should then scan for the apps, and it does it via Bluetooth, and you'll see the serial number of the pump coming up. Just confirm that that's the correct serial number, and then press continue. And then depending on the model of pump that you're using, you'll need to either just press OK on the pump if it's an older RS pump. With the newer ones, it will give you 2 pairing keys on the pump screen, and you simply just enter these into the app one after the other. When it comes to the Donna Eye pump, it will just require a single pairing pin. So it is slightly different, but it does prompt you within the app as to how to do that, and it comes up on the pump. So once the pump PIN code has been entered in, it will then ask you for this trainer's certification code in order to unlock the app. So this will either be the healthcare professional who has done the module and got a certificate, or to the user who's completed the module via the online training. And so either number can be entered into here and then continue. The next job is to link the Dexcom G6 to the app. And again, it prompts you. At the moment, Dexcom G6 is the only CGM that's compatible. So that's the only option there, but you then select continue, and it will at this point ask you for the 6-digit transmitter code, which can be found on the box of the transmitter. It's important here, some people will be coming to this having used Dexcom already and using the G6 app. Similarly to with the pump, the transmitter can only be paired to one receiver or mobile phone app at a time. So you need to make a note of the transmitter number from the G6 app and then delete the G6 app. And on the phone that the G6 app is hosted on, you need to unpair the transmitter in the device's Bluetooth menu. And then at that point, you can enter the transmitter number into the CamAPS FX app. Otherwise, it just won't find it because it's already linked to another app. So once you've got your transmitter number in there and you press continue, it'll then ask you for the weight in kilograms and the total daily insulin dose. These are just whole numbers. And the total daily dose, we tend to take an average of the past 5 to 7 days off the pump. Once it starts connecting to the transmitter, which is the next menu, it'll say it will take about 30 minutes. It usually just takes about 5 minutes. If the transmitter was already up and running previously via the G6 app and there's a sensor that's already active, as soon as it connects to the transmitter, it will start to read the glucose. If there's issues with it, as I say, ensure that the G6 app has been deleted and the transmitter unpaired from the phone paired devices in the Bluetooth menu. For those who are coming to start with a new sensor, once the transmitter has paired, you'll see this box that you can see in the screenshot on the left where it says Start Sensor. You just select the box and it will bring up a screen to enter the 4-digit code, which can be found on the sensor, the peel away wrapper of the sensor. You enter the 4-digit code and confirm, and this will then take you to the 2-hour warm-up. So I'm going to hand you back to Sarah now, who's going to take you through setting up.
Okay, thank you. So just a couple of notes about some things you'll need to do to personalize the app before you go into auto mode. So people who will have hopefully before this point done the training will have kind of gone through all the different components of the menu in detail. So I'm not going to do that now. There's the full user manual is also available on the CamDiab website, but just to point out a couple of key bits really. So one of the important things to do is to set up the alerts. So for people who have been familiar with using Dexcom G6 sensors before, you'll notice that the way the alerts are set are literally taken from the Dexcom G6 app. So they're listed in the same way. So you'll be able to personalize them in the way that you had them previously if you were using it before. And you can personalize day and night. One of the things we're really kind of keen for people to do is be aware of alarm fatigue. Quite often if people haven't used sensors before, they kind of go all out putting everything on highs and lows and quite quickly start to kind of ignore them all, even the ones that would be important. So just be aware, when you're setting them up, not to overdo the alarms. Really just want the ones on that are actually going to be useful, that you're going to react to and are going to make a difference to you. The next thing that's really important is to set up the link to Diocend, and as well, if you want to share SMS text alerts, that's all under the share menu in the drop down menu of the app. So you'll see in the share menu there are two Diocend shares. Most people will only need to use the first one, that they can set up a Diocend account that they'll be able to upload their data to, and also use that Diocend account to share that data with their clinic data, and that will automatically stream while the phone is either has a SIM or is connected to Wi-Fi. The other thing that is really useful, particularly most often for people with small children, is to set up the SMS alerts. So just to be clear, these alerts will only work if there is a SIM card in the phone. There are no alerts sent via Wi-Fi, but there's the option to set up 5 different followers. And essentially what that means is when they're set up, anyone's phone number that's in that system as a follower, any alert that comes up on the person's phone will also be text straight away to the follower as well. In terms of another way to follow, which again is most useful for people with younger children, is using the Diocend app. So with that same Diocend account that you've set up and used with the share, someone else on their phone can download the Diocend app, log into the app with the username and password that was set up and entered into the Diocend share, and you can see the data coming through on the Diocend app. It's not licensed as real time. There's usually a slight lag with it, but that is a good option for being able to follow someone's data. Then there's lots of things in the settings menu that you'll want to look through, but the main things we want to highlight at the moment are setting the personal glucose target, and we talked a little bit about that in the last webinar, and also the bolus step. One of the things in that doctor's mode menu is to put the bolus step on 0.05, and in that bolus step menu you can make sure it's the same there, so you've got the lowest amount of insulin deliverable there. And then lastly, once you've done that, really, they're the main things that you need to do to be able to turn auto mode on, which is the little toggle at the bottom right. And auto mode can be switched on even while the sensor's warming up. And what will happen is it will just stay on the orange attempting screen color until the sensor glucose starts to come through, at which point it will switch to the green screen and say it's in auto mode. If ever you're trying to switch auto mode on and it stays in attempting for longer than you would expect, and you're not sure why, where it says auto mode, there's a little eye which you can touch and it tells you why it's not going into auto mode. So for example, if there's no sensor data, it would say can't go into auto mode, no sensor data available. But if there's ever any issues, that's a really useful thing to just double check. And there's a couple of kind of common questions or issues that come up usually when people start. So one of the things to notice is once you've flipped the system into auto mode and auto mode is running, on the Dana pump itself, it flashes no delivery, which can obviously be quite disconcerting. It flashes between no delivery and basal running at 0.00 at 0%. And essentially what it's saying is that it's stopped delivery of the normal pump basal. And usually above that, it says what extended bolus with the amount of the extended bolus that's running for that 10-minute period. If it had backed off completely, there won't be an extended bolus displayed, though it will just be flashing no delivery. The thing to be aware of, if there really was a problem with the pump and there was an issue with delivery, it would be beeping and buzzing at you and flashing no delivery suspended, no delivery occlusion, no delivery low reservoir, so it would be giving you another message as well as no delivery if there was a problem. So the no delivery it flashes in auto mode is purely saying it's switched off the pump's usual basal because it's delivering the extended boluses. People often ask, in terms of set changes, do they need to do anything on the app or the pump when they do the set change? And the answer is no. You just do the set change on the pump. You don't need to do anything, don't need to come out of auto mode or change anything on the app to do the set change. And when you do the set change, the app will pick up that a set change has been done based on the prime. In terms of swimming or showering and disconnecting from the pump, that's often a question that's asked. With normal pump therapy, we'd say, you know, you can be disconnected from the pump, you know, for up to an hour or so, and you wouldn't need to do anything on the pump necessarily, suspend it. But with closed loop, it's worth, if you're going to be unattached from the pump for more than 15 minutes, it's worth putting the pump in suspend, because the system is basing its calculations on insulin it thinks has physically gone into the person. So if it's not been going in, then that can cause problems. People also ask if there's a reason to switch off auto mode. Generally there isn't. You don't need to switch it off when you're doing a sensor change. One time that you would need to switch it off is if you needed to follow sick day rules. If you had ketones, we would encourage people to take the pump out of auto mode and follow their normal pump sick day rules. Another reason would be potentially if someone felt their sensor was overreading, it might be safer just to switch it out of auto mode until you've calibrated or changed sensor and got that working properly. The other thing people also ask regularly is about bolus timing, and so generally with any closed loop system we'd say it's ideal if you can get your meal, any boluses given for carbohydrates in about 10 to 15 minutes before you eat would be ideal. And there's obviously caveats around that. If you're a bit low at the time that you're going to bolus, you might wait till you're actually eating, but generally 10 to 15 minutes before you eat is a good rule to go by. So I'm hoping we've covered the main points we wanted to. We've gone through the training that you'd need on both the pump, the sensor and the app. We've talked about how you would register and the difference between self-funding versus NHS funding. We've talked about how you download the app from the Amazon App Store and all the things that you need to do to prepare the pump to link. And we've gone through the process of linking the three components, the phone, the sensor and the pump. And then gone through a small amount of the important things of setting up the app that you would need to have done in order to go live into auto mode. Yeah. I'm going to hand back to Candice.
Thank you very much, Sarah and Charlotte. That was a great run through. There's some questions coming up, so do keep them coming. We're going to address them in a minute, but we just want to flag up the next webinars that are coming up. The first one is in 2 weeks' time on the 4th of November. And this webinar is designed, we're going to do a series of case studies showing you the data, looking at how to interpret that data, what changes might be done in quite a systematic way to sort of start looking at how this is working, because of the way the sort of insulin is being delivered via that extended bolus does mean you have to interpret things slightly differently to normal traditional insulin pump therapy on the Diocend. So we hope that will be very practical, very useful, giving you a number of scenarios. So do book into that. We'll also be covering in the next one schools, and then a slightly different fine-tuning to cover more aspects and more scenarios. So please do watch out for those. So now let's go on and take some questions. So the first question is a question, I might have missed it, but I'm guessing you need to have a new sensor to connect to the CamAPS FX system.
No, so if you're already running the Dexcom and you've already got a sensor that's say 5 days in, which you're using via the G6 app, then you can continue with that same sensor. You don't need to replace it. All you'll need to do is make a note of the transmitter number from the app. And sometimes we suggest that people take a screenshot of their alert settings. Then you just delete the G6 app from your phone and unpair the transmitter from the paired devices, which on an Android phone, you just go to the settings menu and then Bluetooth, and then it will come up with a list of paired devices. You just unpair. There may be more than one Dexcom, and that's from previous transmitters. So you just want to unpair all the Dexcom devices. Then when you come to enter the transmitter number into the CamAPS FX app, when you when it manages to connect to the transmitter, it will then automatically straight away come up with your glucose value that it was previously reading, and it'll pick up that that sensor is 5 days through since it was started, because that information is all held on the transmitter, and you're good to go. And as I say, you'll then just replace your sensor in 5 days time, so there's no need to replace the sensor to switch between the two. Sometimes it takes about 10 minutes just to adjust between them, but it's fairly straightforward to do.
Thanks, Charlotte. Next question is, when is the Donna Eye going to be available?
Oh, that's a good question. But,
Sorry, we can't hear you.
we've been told the end of the month. So yeah, hopefully that's the case. So anytime now, really. But yeah, I haven't got an actual date. It was just the end of October.
And from what I understand, the Donna Eye and Donna RS are pretty similar, but they're just a few kind of enhancements.
Yeah, there's a few useful changes. I think it kind of looks and feels a little bit more robust. There are, it takes a AAA battery instead of the Donna RS kind of, what was the word for it? They're just made for those. They look like little bespoke batteries. Yeah. So it takes a normal AAA battery. And one of the things that it doesn't actually cause too much of a problem, but it's just different compared to other pumps, is with the Donna RS and the Donna Eye, you have those predetermined time blocks for morning, afternoon, evening, night for your carb ratios and correction factors. And the Donna Eye has, you know, properly programmable time blocks. You can have the time blocks and settings whenever you want, like most other pumps. I think there's a couple of other things around the set change. They've tried to make that process. It doesn't have its own internal syringe driver. It's still a similar system with a linking screw, but they've adjusted the way that you set the screw length with a different kind of setter. And also there's a window at the bottom so you can check it's all engaged properly. So they've tried to iron out some of those things that people struggle with the Donna RS, which I think will be good.
And then there's another question on sort of software updates, because obviously it's an app. So how does that happen?
It's a great question. So we release new app updates periodically. Sometimes these are obvious and it'll be a new feature that appears on the app. Sometimes you may not notice it and it's something behind the scenes. Whenever there's a new app update, there'll be a notification within the app to suggest that you update. The way that you do that is you go back to the Amazon App Store, and then there, if you go to the bottom, it will say My Apps, and where you can see the CamAPS FX app, it will say Update rather than just Open, and that tells you that there's a new update there, and you can just select Update and go ahead. There'll also be, as anyone who uses Android phones knows, there's a lot of sort of Android specific updates, and generally we just say follow those through. They can be quite slow on the Android phones, and it can often take a little bit of time, but it's worth doing those to ensure that actually the phone's working as well. So there's two different updates, both of which we generally say do as soon as you can, just because it's likely to be an advantageous feature that's come in or something that's beneficial.
Thank you. So there was a question
about just to say, it's probably worth noting, you need to keep the Amazon App Store app on the phone. We've had a couple of issues crop up where people have had problems with the app, and it's because they've deleted, once they thought that they could just install the CamAPS FX app and then delete the Amazon App Store app. You need to leave the Amazon App Store app active on the phone, because that's where you get your updates, and it interfaces with it as well. So just to mention that too.
I'm just going to skip to another question because it's linked to that. There's a question about, what about iPhones?
So at the moment, the app is not compatible with iPhones because it's not available anywhere other than the Amazon App Store. It is something that we hope will be available in the future, but it's not going to be within the next sort of few months or anything. So at the moment, it's purely Android. And as Sarah mentioned earlier, it's really important that the Android phone that you use is compatible with Dexcom, because otherwise that ends up causing quite a lot of issues unrelated to the app itself, but related to the Dexcom connectivity. So not yet, but watch this space.
Great. And then sort of going back to the Donna Eye, is the Donna Eye an upgrade that people will get, or is it buying a new pump? And so if somebody has just bought an RS, do they have to wait, you know, until they're eligible for another upgrade?
Yeah, no, I don't think it's something that's going to be offered as an upgrade. It would be waiting for that 4-year cycle of the pump. So obviously if someone wanted to self-fund and buy the pump sooner, that's obviously doable. But if it's NHS funded, it would be part of that 4-year cycle, waiting for the 4 years to come around to have an upgrade to the next version.
So as healthcare professionals, is it wise if the Donna Eye is coming to sort of hold off the purchase? Is there a cost difference? Do we know that yet?
I don't think so. I think it's comparable. I think it's the same. So yeah, it's definitely worth just getting in touch with Advanced Therapeutics and just saying, you know, have you got a firm date of when they're going to be in the country? I think they're just waiting for them to be shipped.
I heard they were going to be shipped on the 16th, so that was Friday. So they were expecting
hopefully soon, yeah,
to come in the next. It is an international shipment, so with COVID and such like, you know, there might be a slight delay. So they were optimistic for the end of the month. The last time I spoke to them. Right, I think that's it. The questions that I've got through. Any other questions? Pop them in quickly. I'll give you a minute or two. Great. Nothing coming through. In that case, thank you, Sarah and Charlotte, for sharing your pearls of wisdom. It does sound really easy and stepwise. I'm sure just, you know, you've done loads, so it feels natural to you. I think everyone else sort of starting out might not. Oh, there's a quick question coming through. Is it recommended to start the pump initially and then introduce the Dexcom and the app in later stages? Or that's a really good question. You know, how have people, do you do, you know, somebody new to the pump, the Dexcom and the app, do you just do it in one big bang, or what's your experience?
I think if someone is new to pumps, they're transitioning from MDI, you definitely want to have I'd say a short period of just optimizing those normal pump settings, because as Charlotte was saying before, you want to be in a position, if the system does flip out of auto mode into open loop, you want to know that those pump settings are there or thereabouts. So if someone's brand new to a pump, you'd probably want to just optimize those for kind of a week, 10 days or so, till you're happy with the basals particularly, I'd say, because generally, even if you were on a pump before and you were pretty confident that your carb ratios were right, when you go into closed loop, you often need to adjust the carb ratios anyway, because the insulin's just being delivered in a different way. So I think if you're switching from the one pump already to the system, there's probably not much to be gained. I think, you know, the functionality of the app, you probably just want to get straight on it, and there's probably not much to be gained just using that new Donna pump on its own for a period of time before you add in the sensor and the closed loop itself. So I would say if you're already on a pump, just switch straight across to all of it. If you're from MDI, then probably, you know, a week to 10 days to just optimize the basal would be useful.
And I think sometimes it can be, if somebody's new to sensors as well, we've done a little bit of training of people where they've gone onto everything in one go, and it probably does take about 2.5 hours, and that's quite a lot of information for somebody. It is, if people are already on a sensor and as Sarah says, already on a pump, that's very manageable, but otherwise you might find it easier in terms of information being taken on to split it. But it sort of depends on the individual really, and your confidence in delivering the training.
And just going back to sort of the online training, it is quite helpful that people can go through the Donna refresher training. They can go through the app training so that they can, you know, revisit that a number of times. The next topic we're launching and we're busy writing at the moment is a G6 refresher training. So if people are used to using other devices, they could potentially do that training prior to coming to the session. So there's stuff that people can do at their own time and at their own pace to be able to then just do the finessing and putting it all together at the appropriate time later. There is one question that has popped up again about using the Amazon app on an iPhone. Can you access the Amazon app on the iPhone, is it, or it's completely Android?
No, you can't, I'm afraid. It's completely Android based currently. Sorry.
No, I thought as much. I just wanted to check. Right, I think that is our session for the evening. So thank you very much again, Sarah and Charlotte. Thank you very much to everyone who's listened in and asked questions. I think it's been a great session. The session has been recorded and it will be uploaded to the CamAPS FX online training. So please feel free to have a look at it again, because I think there were some key points about certain settings and things like that that you might want to reference later. So it is going to be available on the website. So please do have a look if you want to refresh yourself later. But thank you very much, everyone, and good night and have a good evening.